Well, South Dakota Senator John Thune joins us now to talk about that and more. Good to see you today, sir.
Good to be with you. Thanks, Shannon.
What do you make of this and the characterization that folks on the Hill, the GOP, are not united in what the plan is moving forward? We hear they've got multiple different plans within the House. We hear the White House may be sending down its own plan. What's the best course of action?
Well, there are a lot of good ideas out there, but we welcome the input from the administration. If the president wants to lay out a plan, we look forward to working with them on that. All we know is that we've got to do this. This is a failed system. It is an example of the failure of liberal economics and central planning trying to define what health care coverage is for all of America. And we need a system that's more flexible, that creates a more patient-centered, personalized health care that is affordable literally for every American. And what we hear most people talk about is cost. They want to see the cost come down.
So if you try to keep the things, though, that we hear the administration talking about, a lot of the things that are important to people, covering pre-existing conditions and possibly keeping people on till they're 26, that has a cost as well. Where do you make up that money by dismantling parts of the program and giving people more autonomy about what they do, while also trying to keep the good things that people really love about the plans?
Yeah, and I think that the key there is really there's a better way to do it. You know, what Obamacare tried to do is to dictate this from Washington, D.C. with a one-size-fits-all solution. And these are discrete problems that can be solved in different ways. The issue of pre-existing conditions, there's a much better approach that we think involves high-risk pools where states have flexibility to design plans that work better for their constituencies. And the same thing is true with respect to making sure that people, 26 and under have access. I think that all these issues can be solved, and we'll come together behind a plan. But in the process, it takes some time. We have lots of different ideas and good ideas, but what we know is what we have right now is a failure. And whether Hillary Clinton had won this election or as Donald Trump winning the election, we knew we were going to be having this conversation because it has to be fixed.
Well, Congressman Mark Walker, who obviously heads up one of the more conservative elements and groups, very powerful groups over in the House, says the bill contains what increasingly appears to be a new health insurance entitlement with a Republican stamp on it, referring to a plan that was leaked. We're told it's not up to date. There are changes to it. But can you understand why the most conservative over there are thinking and opposing what they understand to be the plan right now, and that they don't want to sign off on something that's just more money, kind of good after bad?
Right, but if you look at how that would work, advanced refundable tax credit is a very different approach than having the government subsidize these plans. It allows people to make choices. It creates competition. And those are the things that drive down cost. And as I said, most Americans, what they want to see come out of this is they want to see a reduction in cost. Premiums this year in the exchanges, on average, went up 25%. In 7 states, they went up 50%. And you've got, 1/3 of all counties in the country today that only have one option. This is not working. It's a failed system. And the refundable tax credit that's being talked about as a feature in the House plan really is a much different approach than what is in place right now. And it involves individuals, giving them the choices, allowing insurance companies to compete for their business, and that will have a profound impact on cost.
We've had the governors in town over the weekend, and many of them have taken Medicaid expansion, which has covered millions of additional people with some type of health care option. They're very worried about anything that would strip that away. There's been a lot of talk that some of these plans are going to pull that federal funding back. I mean, it is something that has a price tag to it. Those governors very concerned, but some of them, they didn't take the option, and they think it isn't the best way to use this money, to have the federal funds pouring in and telling them how to spend it.
Right. Well, and there are 33 Republican governors, and I think in about half the states they did expand, and about half they didn't. And then you've got 17 Democrat governors. So obviously you've got to get these people involved in the discussion, and that's why I think the conversation that occurred yesterday was a good one. And it's important in the end that we get a plan the governors can get behind. And so soliciting their input, figuring out how do you make this Medicaid program equitable, and the things that are done. If we're going to distribute power and resources back to the states and allow them to run it, give them more flexibility, how do we make it equitable between states that expanded and those that did not? And that's why I think it's really key right now to have the governors involved in the conversation. But in the end, that will save billions and over a long time period of time, trillions of dollars if you do it that way, as opposed to having Washington do it and make